Welcome to the TED Congress here in Scottsdale, Arizona, 2024. I have the distinct pleasure of having Dr. Robert Frykberg here, and he's going to, first of all, introduce himself, for which actually he doesn't really need an introduction, and then we're going to ask him a few questions, not only about his career in this field of podiatry and limb salvage, but also about a few topics that he is going to be delivering at this meeting. Okay, Dr. Frykberg,
all right, thank
describe
you,
your journey.
Okay. Well, I started in Boston many years ago, back in the 70s, when we were all young whippersnappers, and I had the fortunate opportunity to train in the Harvard system, which was the epicenter of vascular surgery at that time in Boston, where we had early pioneers like Frank Legerfo and Gary Gibbons, and before that was Frank Wheelock and Carl Hoare. So this is the environment that I trained in. So vascular surgery and podiatry had been married in my mind ever since I started practice, which is over 45, coming up to 50 years ago.
Where do you see this combination, and how would you get everybody involved in what we are trying to do, which is basically saving limbs and saving lives, as well as addressing the huge problem we have with diabetes, early detection, getting a multidisciplinary team together? How has it been over the last 40 years?
Well, now, it's interesting you say that. In 1934, Elliot Jocelyn published his first article on the menace of diabetic gangrene. Now, Elliot Jocelyn started the Jocelyn Clinic in Boston in the era when insulin first came about. And he had his own foot care team in the New England Deaconess Hospital with his own nurses, his own surgeons, the McKittrick brothers, and himself and Dr. Bailey. So I've been practicing in the multidisciplinary environment all of my practice, but now it's recognized more so as the way to go. As I said earlier, I've also practiced in concert with my vascular surgery colleagues. Right from the very get-go. Where I've seen the changes, as we all have, are in the increasing role of endovascular therapy, which came about in Boston, probably in the mid-90s they started doing that because there were so many extreme distal bypasses being done. Where I practice, dorsal pedal bypasses were happening every single day of the week because we were a major referral center. So the change has been in endovascular therapies, as well as new wound care therapies. Exactly. There were no advanced wound care therapies back in the early 80s and certainly not in the 70s, but now we've seen some amazing new products come on the market.
So at this meeting at TED Congress 2024, I see that you're talking about a couple of topics. One is osteomyelitis. Can you briefly describe how you detect it and what are the consequences of having infection in your bone?
It's critical. If there's two major problems in the diabetic foot, aside from the ulcers, we know it's peripheral arterial disease and recognition of peripheral arterial disease, which is a major stumbling block for many people, and also the presence of underlying osteomyelitis under those chronic wounds. And where I practiced, there was a very important paper by Grayson published in 1995, which indicated the important role of simply probing to bone as a great clinical indicator for likelihood of osteomyelitis. And of course, we do our x-rays and now we have MRIs, but I always go back to the basics because nothing supplants the basic examination and the basic care. So look for it, you'll find it. It's going to be there in long-standing ulcers, especially in people with significant vascular disease or prior infection.
Now, the other topic I can briefly touch upon is topical oxygen. I know we have hyperbaric oxygen, we have chambers that are solitary chambers, we have chambers that can accommodate 8 people, but it's also associated with significant risk in terms of clearance from maybe your ears and a coronary disease. Topical oxygenation probably delivers very focal oxygenation to the wound itself. How does that happen?
It's funny. There was a paper in 1988 published out of Rancho Los Amigos by Leslie. That was a very bad study that would never be published in diabetes care now, and they said it didn't work because after 2 weeks, they didn't see any improvement in wound healing compared to controls. And despite that, would you believe that topical oxygen was first reported by Fisher in The Lancet in 1969. Okay,
Whoa.
so this isn't some new fly-by-night, new type of therapy. But there's been interest in topical oxygen since 1969. There just were no high-level, robust studies. And because of that, hyperbaric people says it can't possibly work. It cannot possibly work because it's not systemic. Well, guess what? Animal studies have shown that it works, that it can improve local tissue oxygenation by 4-fold in just 4 minutes. We did a very robust study published in Diabetes Care in 2020, completely sham-controlled, double-blind, compared to room air in a sham device. And we showed significantly more healing in 12 weeks, not 12 months. Now, most HBO studies report on amputation rates in 12 months. How does we compare 12 weeks to 12 months? So HBO is necessary, and there certainly is a role for it. But if you look at the studies for diabetic foot ulcers, which is most of the studies, compare topical oxygen with hyperbaric oxygen with outcomes at 12 weeks, topical oxygen beats it every day of the week. That's why the ADA, because of inconsistencies in HBO papers, no longer recommends it as a first line of therapy. They don't say you can't use it. They just say that topical oxygen now, because of 5 or 6 systematic reviews, 4 very robust clinical trials, have shown superior healing compared to controls. So there's a definite role and a move towards topical oxygen. It's a home-based therapy.
Very true.
It's a home-based therapy. No trips to the hospital, no trips to the clinic. All treatments are done at home. And there's very little risk, as long as you're not smoking when you're doing the oxygen.
Thank you, Dr. Frykberg. It's been a pleasure to have you for TED 2024. And thank you again for all your contributions to this field. And we look forward to seeing you again next year.
Absolutely. Thank you so much.
Thank you.
Thank you.